Hi, students. We are going to cover the last chapter of the semester today. Chapter 20 focuses on nutrition during adulthood, but I am going to focus, as the chapter does, on the elderly and their nutrition needs, because this is a population that is increasing. And not only is it increasing in terms of the percentage of the total population, these are also individuals that often have complex health and nutrition needs because of chronic diseases, because of medication use, because of socioeconomic issues, because of physiological changes with aging. So there's a lot to talk about here. You can see that the percentage of these older adults is increasing. We saw a lot of that as the baby boomers reached the 65 and up age. And of course, this has some bearing on healthcare for sure. So we need to start off by talking about healthy aging, and it's very possible. And when you complete your discussion for this unit, you will watch a TED Talk on the blue zones and meet some people who are aging quite well. We see less of that in this country, but we still have some good role models. Here we see that if we want the population at large to have better aging, we need to promote healthy aging. And that includes things like environments, that includes things like healthcare, certainly, and support services. You can see that behaviors come into play, individual behaviors and lifestyle, as well as genetics in terms of how people age. But we also have to keep in mind, especially since you will be working as healthcare professionals, that the environment becomes very important as well. So what about the lifestyle? When we talk about a healthy lifestyle for older people, what does that mean? Well, I want to back up a little, because the first thing it means is that at all points in life, focusing on a healthy lifestyle will bring better aging. So this starts early. When we look at countries in the blue zone or localities in the blue zone like Okinawa, we see a lower rates of chronic disease and certainly longer years. So not only longer years or more years to life, but better quality of life as well. And we see common themes regarding the diet, with it being plant-based, very low in ultra-processed foods for sure. So you can see that lifestyle includes our food choices, but also our exercise. Notice that when you watch the Blue Zone video, or physical activity patterns, if we're using any substances that can have a negative impact for sure, and avoiding the habits that could take years off our life. One of the diets that is the best for almost everything, but certainly for aging, is the Mediterranean diet. There has been lots of research to show that the Mediterranean diet can improve cognition, decrease cognitive decline with age, and improve physical health as well. Okay, so let's look at some nutrients, and let's start with calories, though not a nutrient per se. Calorie needs decline with aging, and this is due to many different things, including the metabolic rate, and for many, decreased physical activity as well. The metabolic rate is certainly influenced by a change in body composition, which we'll talk about. Exercise can offset this quite a bit. So it's very important that we encourage older people to continue to be physically active within their physical abilities. One of the things we notice about calories is if people don't change their calorie intake as they get older, they gain weight. You may have noticed this. So here we see the calorie needs of a 70-year-old have to be reduced by 100 to 150 calories, maybe even more in some cases. Protein is interesting because protein needs, we now believe, protein recommendations should be higher in older people. So instead of the 0.8 grams per kilogram, up to 1 to 1.2 grams per kilogram. What we're concerned about is sarcopenia, the loss of muscle mass and strength with aging. And what we're seeing is more protein might offset that. Not only more protein, and we talked about this in the protein chapter, but also protein at every meal. So protein evenly distributed over the day for best utilization. Budget can get in the way here. Chewing issues can get in the way here as well. And for some, excessive protein is not recommended, and that is anybody with kidney issues as they age, which is not uncommon, by the way. As far as fat needs, the recommendations here are not to go overboard with fat and to consume the healthier types of fat. For sure, your textbook links this to the chronic diseases that we've talked about throughout the semester. But I would also mention that fat can take away from appetite. And there is something that's termed anorexia of aging, which just means loss of appetite with aging. And too much fat in the diet could make this worse. Okay, it's important to have a good appetite in order to get all the nutrients that you need in your diet. For carbohydrates, we really need to focus on fiber. Older people are at a higher risk for constipation because of slowed motility, because of medications, not enough fiber, not enough fluid, and all of those problems together can increase the risk of constipation. So having enough complex carbohydrates with fiber is important. What the older individual needs is not so much different from the younger individual, but keep in mind, they need all of the nutrients and then some with fewer calories. So again, the diet should be based on very nutrient-dense foods. Okay, water is another big nutrient of concern for a number of reasons. Sometimes older people self-restrict because they are having trouble with incontinence. They don't want to get up and down to go to the bathroom. They're having to urinate more frequently. We also know that the sense of thirst is blunted with aging, so people don't feel thirsty. And because there's less total body water and the kidney is less efficient at actually balancing fluid, older people can be at a risk for dehydration. Dehydration can cause many problems, from respiratory infections to skin issues. And also it's one of the leading causes of confusion, especially in the hospitalized elderly. So plenty of fluid is very important for older people, and they may need to be prompted to consume enough fluid. Some other minerals of concern are listed here: calcium and iron, zinc, magnesium, and sodium, sodium being an excess, the others being a low intake. I did want to mention with the zinc inadequacy is very common, and it can lead to problems with the immune system, problems with skin integrity, and also problems with sense of taste. So it's really important that zinc be attended to. Because of these issues here, as well as the vitamins that we'll see, it is good advice for many older people to take an age-specific multivitamin with minerals. Another reason is right here with B12. B12 absorption declines with aging. It is better utilized when an older person has a low acid stomach problem, okay, trophic gastritis. It's better utilized when it is not attached to protein. So B12 in a vitamin supplement may be a good idea. Vitamin E is an antioxidant, as well as these carotenoids. Fruits and vegetables, of course, are great sources of those carotenoids. I mentioned sarcopenia. You should understand what that is. It's something we see typically in aging, and it's a loss of lean body mass. What you're looking at here on these slides is the loss of lean body mass that occurs with aging. So there's muscle cells that shrink and accumulation of fat and collagen as well. Now, this loss of lean body mass brings a loss of strength, which impacts everything from risk of falls to quality of life in general, as far as being able to climb stairs, perhaps, or carry grocery bags. So strength is important, not just for the young, but throughout the lifespan. Some other changes that occur, of course, are obesity. So there's a loss of lean tissue, an increase in fat mass, and I did mention decreased body water. Weight loss is not uncommon. Okay, so when you're talking about older people, it's not uncommon that you see weight loss for a number of different reasons. Many are listed here. So depression, medications, food just not tasting the same, not being able to chew, the list goes on and on. Being more physically active, again, within any medical restrictions, can increase appetite. So again, it's important to assess physical activity and then to make some recommendations there. Physical activity, especially the strength exercise and the weight bearing, is also good to lessen bone loss that occurs with aging. So that's very important. Weight bearing exercise, enough vitamin D, calcium, and protein, but looks like not too much protein, not going far overboard, and watching the smoke and not smoking, and lessening the drinking of alcohol, all can be important. So arthritis is another common concern. There are many different types of arthritis. What you're looking at here is the effect of osteoarthritis on the cushion between the bones. So you have bone to bone contact, which is very painful and causes inflammation. We know that a dietary pattern rich in antioxidants and anti-inflammatory phytochemicals is helpful. So that fish oil, the best from the fish from the diet for sure, and all of those good antioxidants from the fruits and vegetables. We also know that excess weight is hard on the joints, so managing weight is important. And we also know that exercise, even though it seems counterintuitive, actually can help manage the pain of osteoarthritis. So physical activity is something we want our elders to be participating in. There's certainly many different types of physical activity, and most people can find something they enjoy, from puttering around in the garden to playing with their grandkids to walking the track. It is important that the different components of fitness are included, and it's also important that the older person check in with their primary care provider just to make sure that what they're planning is within their medical guidelines. Okay, so other changes with aging, certainly the digestive system is impacted from start to finish. Many people have problems with dentition and difficulty with harder to chew foods. Sometimes pureed foods are necessary, but sometimes it's just a matter of softer foods as well. We know there is less acid in the stomach, and some have less production of intrinsic factor, and that can affect the absorption of B12. And we see constipation quite frequently, and I mentioned that already. As far as nervous system, we mentioned decreased sense of taste and smell. There can be cognitive decline, which impacts things from using the stovetop to preparing meals to transportation and shopping. And some people have problems with hearing and vision, which also can have major impacts. As I mentioned, a diet rich in carotenoids can affect the risk for not only macular degeneration, but also cataracts as well. The immune system of the elderly is often compromised to some extent. So it's very important that a healthy diet is in place so that we can minimize this. What we know is harmful to the immune system is obesity, excessive fat, excessive iron, and excessive zinc as well. Food safety, of course, is very important. And as far as the hormonal system, we see a decrease in insulin sensitivity. So we need to pay attention to not only management of blood sugar, but prevention of type 2 diabetes. And the hallmarks of that are maintaining a healthy weight, being physically active, and eating a healthy diet with very few highly processed foods. Chronic disease is common in elderly people, and you can see the statistics here. And chronic disease can have an impact on nutritional intake, and nutritional intake can have an impact on chronic disease. With chronic disease often comes increased medication use, prescription, and over-the-counter. It's very common for older people to take a number of medications, and they may not only interact with each other, but they can also affect appetite. They can also affect the bowels with constipation or diarrhea. They can affect the flora, the microbiota as well. So all of these issues can have an effect on the nutritional status of the older people, and they need to be assessed. Really, every older person should have what used to be called a brown bag medication review to make sure they're taking what is necessary at the right times to minimize these effects. There is a My Plate for older adults, and I really, really like it. You can find it online. Tufts University does a lot with nutrition for older adults. And what you see here is the My Plate, that have fruits and vegetables, but interspersed with the images and the text are some very storable, low budget items that are still nutrient dense. It's important to note that seniors who are living alone may not be crazy about buying a whole lot of fresh produce because they can't use it quickly enough. And that's okay, because frozen fruits and vegetables and even low sodium canned vegetables or low sugar canned fruits are a good option, especially the frozen. The frozen is closest to fresh in terms of nutrient value. You can also see that there are ideas for some low expense protein sources and some softer protein sources as well. So it is important to note that this diet can be worked for older people to fit their needs. Some suggestions and strategies are on the left-hand side there. The benefits of optimal nutrition are many. We can't stop thinking about nutrition when we think about older adults. You know, they're old, what does it matter? It actually does matter. It delays the onset of some disease. It improves the management of existing disease. It helps them recover more quickly from illnesses. And maybe most importantly, as it increases mental, physical, and social well-being, it improves quality of life. I've told you already about the relationship between diet and mental health, and this goes into the older years. I think it was the nurses' health study where they found that the better diet decreased the risk of depression. Contact me if you want more information on that. We know that eliminating those ultra-processed foods and eating what you're seeing in this beautiful picture here are more likely to bring better physical health and better mental health at every stage. Now, we shouldn't end a discussion about the elderly without talking about nutrition services to support them. We have an Older Americans Act in this country, and it covers several things, including congregate meal programs at senior centers, which are very nice because they do a good job of covering at least a third of the nutrient needs, plus providing socialization and stimulation. These aren't adult daycare centers, by the way, although those exist. Senior centers are social community groups, and they provide meals, and there are quite a few of them in Philadelphia. We also have Meals on Wheels. Philadelphia Corporation for Aging takes care of Philly's Meals on Wheels, but these are provided to the older adults to cover most of their meals for the entire week. And of course, SNAP is an option as well. Food cooperatives, food banks, etc. I think what's important to remember is we need to look at the environment. We need to look at the socioeconomic issues in order to adequately address the nutrition issues. Okay, so this chapter is followed with a little section on alcohol, which is especially important for the elderly because they are more sensitive to the effects of alcohol, and it can hasten cognitive decline and, of course, cause a number of problems when taken in amounts that are not healthy. But it also applies to all of us. The big question is here is, can alcohol be part of a healthy lifestyle? And the answer to that is a conditional yes. And let me explain as we go along. First of all, we have to know what moderation or how moderation is defined. It's defined as 1 drink a day for a woman, 2 drinks a day for a man, and that is a daily basis. You can't kind of save those up and use them all on the weekend. A drink is relatively small compared to some bar drinks. It's 1 shot, not 3 or 4 that's in some mixed drinks. It's a little 5 ounces of wine, which is a fairly small glass, a 12-ounce beer. What we see with that moderation is a lower risk of cardiovascular disease and type 2 diabetes, and for some, a higher quality of life because of socialization and relaxation. Now, the cardiovascular disease link seems to be due to a couple of factors. Alcohol, not the specific type of drink, but the actual alcohol increases your HDLs and it thins your blood a bit and lowers homocysteine. So these things decrease the risk for cardiovascular disease. But there is a however, and the however is, there's actually 2 howevers. In excess, these benefits disappear and the risks pop into play. Okay, so there are all sorts of risks with too much alcohol. But let's keep talking about moderation. Even with moderation, the increase of cancer, certain cancers increase. So that and more is one of the reasons the Dietary Guideline Committee wanted to make it 1 drink a day for men and women. They really didn't see the research where men should be able to equate moderate drinking with 2 drinks, but that did not change. But it's also the reason that some medical groups and nutrition groups and other health groups have come out to caution on even moderate consumption of alcohol use. If you're concerned about a risk for breast cancer, for instance, or you're a breast cancer survivor, it should be less than moderate. Okay, there is a link there, and we want women to know that, and we want them to keep it to the occasional. Okay, the occasional celebration or holiday, not the everyday type drink consumption. All right. So the risks of heavy drinking that I alluded to are many. So it's a fine line. Moderation, good for cardiovascular, not for cancer. Beyond moderation, no health benefits and has a negative impact for sure. Okay. Alcohol use disorders are not uncommon. Look at those numbers, 17% of adult men, 8% of adult women at some point in their life. And this is a formal psychiatric diagnosis where the pattern of alcohol use leads to significant impairment or distress. We know that, or we believe that studies suggest that half of a person's risk for this is genetic, but it's not only genetic. And I did want to make something very, very clear as well. The effect of excessive alcohol consumption is certainly on the liver. And you see the healthy liver on the left and the liver with cirrhosis on the right. But it also affects all systems of the body. It can affect the pancreas, okay? It can affect the brain. So it's not only the liver, as if that's not enough. Excessive alcohol consumption can lead to many different health issues. All right, so there you go. Have a great day.